All right. Hi, everyone. Hope everyone's doing well. We will go ahead and get started. Welcome to our Strategic Plan Guidance Community of Conversation. Thanks for joining. Just some quick housekeeping. Today we'll be hearing from Jim Lesko today, and of course I'm Sammy Couture, and I'll just be covering some basics here. Here's a list of the folks that have been invited to this call today, so thanks for joining. We've got grantees, some consultants, our TA team is on the line, some of your FPOs and regional office staff, and then some of our TA partners from some of the national centers were able to join us today. These are voluntary, so we appreciate your time. All participants have been muted, but please feel free to type your questions in the chat box, or you can use the raise your hand feature and we will be sure to call on you. If we do call on you, you just need to hit *6 to unmute yourself. So today we'll go over the strategic planning guidance that came out, and then we'll also hear from two of our grantees in the field who are going to talk a little bit about their processes. So for those folks, before you start talking, just a reminder to hit *6 as well. We will share this recording with everybody so you can send it to folks on your team who are not able to join today. And we understand from the feedback from last week that some participants are interested in getting that recording more quickly. So please know that we heard that, and we are going to work on that and make that faster so folks can get that to you. So thank you for that feedback. And if you were able to join our needs assessment community of conversation last week, we had a discussion about sharing some workforce surveys that other states said they were willing to share. So just a heads up that we are working on gathering those from those states, and we'll send those out once we gather those, just so folks know that's on our radar. And also, you may have seen on Friday that we sent a notice that the statewide longitudinal data system is hosting a webinar on early childhood data analytics. And that webinar is going to be June 24th. So if you are able to join, we would love to invite folks to join them in that webinar presentation. So just a reminder again, we welcome folks to chat in the chat box and post questions throughout this discussion today. And now I will pass it over to Jim to get us started. Jim, are you there? You may be on mute if you are chatting over there.
There we go. I thought I hit it, but I didn't push the buttons hard enough. So,
no worries.
Welcome everyone. Today we're going to have a discussion on strategic plan guidance. This document went out to the grantees approximately 2 weeks ago, so you've had an opportunity to hopefully read through the document. I am going to go through it in sequence, so I won't actually pull up all of the documents. I will pull up a couple of the pages as we go through our time, but I'll walk you through the document page by page. So if you want to have it in front of you, open your file drawer, pull out the copy, and we'll see as we go. You'll have a reference. And please ask questions. We'll have a participant question and discussion opportunity. As was mentioned, there is the chat box on your screen. Everyone has been muted, which helps keep the noise down. If you would like to pose a question, please put it in the chat box. We have the team readily watching. You will also happily help you unmute so you can voice your question as well. We have the fortunate opportunity also today to have two of our colleague PDG B-5 states join in the conversation. One will be Laura Kastner from Virginia. Will share some of the process that they've used so far to date in pulling together their plan. And Alyssa Chatterjee from Oregon will also share with us today. So you'll have an opportunity to hear what they have to say, the process that they've gone through in their states around strategic planning, and you are also free to ask them questions as well. We'll conclude with some additional conversations and questions, and then have a closing and some follow-up. So let's talk about first what the grant requirement is around strategic plan. And that is to develop and revise a plan. So some states have very new to the process, have not had a plan in place, and using their needs assessment data, qualitative and quantitative, they'll pull together a plan. We know that we also have a number of states that either have gone through the needs assessment process up to the point of completing their application last year, in some cases also having crafted a strategic plan, and they're in the revision process. So they're relooking at some of their more current needs assessment data, as well as looking at the guidance that came out from ACF around the needs assessment and strategic plan, and completing some revision to their existing plan. That plan is intended to support and facilitate collaboration and coordination among existing programs of early childhood education in a B-5 mixed delivery system within a state or territory. The plan is to focus on establishing and maintaining an early childhood system that is designed to support all children and families, but particularly those identified as most vulnerable by their state or territory. I think you will hear me say this several times throughout the call today, and I know that this has been emphasized by Richard Gonzalez at N. Shannon Christian at ACF, and most likely from your federal project officers. This plan is a plan that you all are writing for your state purposes. It is a requirement as a recipient of grant funding from Health and Human Services and Department of Education as the joint initiative to support early childhood education for the most vulnerable population and their family. However, we do want to make sure we emphasize that the plan that you create is the plan that you're sharing with your stakeholders, your constituents, your partners, your other state agencies, your legislators, and families. This is a plan that your state is making a commitment to all of your stakeholders and partners to move your system over the next several years, anywhere from 3 to 5, or if you've developed a longer plan. While it's a requirement to submit this as a part of your grant, we want to emphasize the transparency nature of the plan and that you're utilizing this as a guide and a journey for your state's comprehensive birth to 5 mixed delivery process. So the context for the plan is that it's, number one, based substantially on the needs assessment information that you've pulled together. This could be the data that you've acquired over the time period since either the grant was awarded to your state, or hopefully you've pulled together a cohort of data and needs assessment from a variety of your stakeholders and are aggregating that into a usable set of information that you will be able to identify what your state's strengths are and where are the particular needs for the population that you've targeted. As well as qualitative information, we do know that we have a number of states that are working on focus groups and written and online response survey data that that states will bring together as a part of the more comprehensive needs assessment process. The plan will reflect a comprehensive perspective on supporting children and families birth to 5. I've talked about that. The plan will reflect and outline stakeholder and partner input and collaboration from the birth to 5 mixed delivery system. There will be sort of a side-by-side that will happen, looking at your state's needs assessment and the state's strategic plan, making sure that they are adequately informed, and there's a loop of information between both processes. And there is a section within the strategic plan asking you to identify your strategic partners and stakeholders that have been a part of the planning process. And so that will be looked at as a part of the review. It'll be important to make sure that the plan reflects and speaks to a parent voice. States are doing this on behalf of children and families. I know that it can be difficult at times to reach out and get that parent voice. Most of you understand how the critical importance of that, because they are the consumers of much of what states are providing on behalf of their children, so their voice is critical to the process. The plan that addresses maintenance and sustainability, there is a long-term perspective being asked of states to look out 3 to 5 years, and that the state is exploring supports and services that can be put into place that are not solely federally supported, and where the state's going to be able to sustain and maintain many and or most or all of the activities that have been identified. I think that there is an expectation and a realization that states are not going to accomplish this by the end of this grant period or in their first year of operation. But it is a long-term strategic plan, and that there's a recognition of the necessity to maintain and sustain the things that states have identified as being important. And then for some of this strategic plans that I mentioned, that they do reflect a revision and update. If a state created a strategic plan a year ago or 2 years ago, it will be important in whatever document or set of documents that a state provides the federal government to reflect the work, that if it is a plan that's a year or 2 or more old, that it reflects what revisions and what updated data has been put into the plan to make it much more current and address the immediate needs of the population that you're addressing. There is an expectation that the plan, the outcome of the plan, identifies and reflects the full range of stakeholders that have been involved in the process. They're going to want to see that you list the names of the stakeholder groups and the names of the individuals that have participated in the process. If you're doing large focus groups, I would just say make sure you've kept good track. I don't know that the particular names of those individuals are necessary as a part of the plan, but you could certainly include them as attachments and be prepared to be able to provide demonstration of the types of stakeholder input you've been able to obtain. And I know that you all are working very hard at that. That the plan lays out is clear with goals and objectives and action steps. That the plan addresses a comprehensive nature of the mixed delivery system, that it identifies the partnerships, collaborations, coordinations, and the quality improvement activities that the state will leverage, including policy alignments and program service delivery across the B-5 system, and that you identify activities that address transition of children and families within and across systems and into elementary school. This brings me just quickly to address that, the interested in terms of transition, that you're not only looking at the transition that moves children from preschool into their elementary, kindergarten, or first grade setting, whichever is the first or next level after preschool into the the greater K-5 system, but also an exploration and a cognitive recognition of the other transitions that are happening below the age of 5. And those are transitions that may come from infant and toddler programs into preschool, how professional development is going out to the early care and education system within your state around transitions within centers, transitions across centers, transitions across programs, that you understand and recognize that there isn't even a legal requirement between the Part C and the IDEA 619 3-5 Early Childhood Special Education System. There's some legal requirements around transition. And Head Start has some expectations around transition. And so that, there's a reflection that the state has considered these types of perspectives as a part of putting the plan together. Within the plan itself, there are a few categories of expectations. One is that the plan delineates how the state plans to build, support, and enhance improved coordination and collaboration. That there's a framework in place, and that framework reflects how the state addresses increased participation of children in quality early childhood education programs, services, and settings across the mixed delivery system. That the plan reflects access and recognition of the federal, state, and local statutory requirements and barriers that are in place. There, and we'll have a question that'll come up in a bit about this, but and this is a good time to reflect that there are a variety of levels of funding and policy expectations around the particular and distinct programs in states. Sometimes they are federal or state or local perceived barriers. Sometimes these are policies that are perceptions rather than statutory expectations. And it'll be helpful to provide evidence of the state's exploration of these policy and statutory requirements, and where possible, to work towards becoming to some negotiated level of agreement around how these could work better. Within the plan, that there's an identification of the data, of indicator data, to access progress, to assess progress, desired outcomes, inform the cost, resource efficiency, and continuous quality improvement of what's happening within these programs. And last, a description of the continued involvement of your state advisory council and or other entity that you've designated within the state to assist you in advising the progress and services being provided to this youngest group of children. So that moves us on within the guidance document to a description of the linkage between the needs assessment and your strategic plan. So this is a list of the particular domains that you were asked to address in the needs assessment process. And I'll go and just read them quickly. That would be the focal population. So what is the definition that you've provided in your state for the vulnerable population that you've identified to work with? What is the quality, access, and availability of early childhood education services across the regions by demographics? So some examples are, how accessible is high quality or good quality education in specific geographic regions or by ethnic group or by age? Have you been able to address the issue of unduplicated data? If you don't have the capacity at this point to address unduplicated data, what are your plans to address this over the next several years? Do you have gaps in quality and access? And this could be certainly linked to the first a second bullet on access and availability. Are there gaps in collaboration? So, are there particular aspects of your system where that is working well, and are there places where it's not? And then in your strategic plan, what are the action steps that the state has identified to enhance and strengthen the collaboration practices among and across agencies on behalf of the population of children that you're serving? What are your measurable indicators of progress? What did you have as a part of your needs assessment? And then your plan will move into what do you intend to put into place and implement as a part of those indicators. What are the facilities that you have available? One of the aspects that we've realized that some states aren't considering is, given that the gaps in services, or the gaps in the number of children who have been able to access services, are the number of facilities adequate to support should every child have an opportunity to access early care education? And what would it cost for the state to bring up enough facilities online and be actionable to meet the needs of children? Are there barriers of funding? Are there policy barriers that make it more difficult to either support services or to lend and braid funds? Are there transition? I've already talked to you about the transition, but what are the needs related to transition? What is happening, and what could the state do to enhance the transition process? What are the goals and action steps that may be needed for each of these particular domains that I've talked about? Identify the goals in each domain. Relative to, as you've identified them, highlight them on behalf of the reviewers. And addressing each domain in a narrative to reflect consideration of those areas. In your executive summary, I'll say this now and I'll say it again in a couple slides, it will be important to walk your reviewers. So this will be the team that will be examining your strategic plan, helping them understand how you've linked, number one, to each of the domains that I just talked about, and those are the same domains that are listed in your needs assessment document, the guidance document. How have you addressed those particular needs, and where is it easy to find reference to those within your strategic plan? If there are particular domains that don't need additional enhancement, what you'll want to do is provide some recognition of that in your executive summary or within your strategic plan, and say that currently the state has met the required expectations around, let's say, transition, but perhaps in the future you'll continue to monitor the progress and processes of transition, and will make sure that you do an ongoing temperature check and make modifications where that may be necessary. It will be important as you examine the collaboration and comprehensive perspective of your plan that you're taking into account the broader system. So within the middle of this diagram, this system diagram, you'll see the system elements, many of which reflect the domains that I've just mentioned: policy, governance, financing mechanism, data quality and linkages, workforce development, family involvement, transition, quality assurance, and mentoring and evaluation. But outside of that system element is the broader early childhood system of, for instance, healthcare, behavioral health system, child protection, supporting children with disabilities, economic assistance. As you explore the needs that you've identified from your needs assessment, and you link them to your broader strategic plan in support of children and families, how well is that circle connected as a part of your strategic plan will be an important consideration as you pull your system together. So that was a lot of information out to you. I just did a lot of talking myself. It's time for me to take a break, and it's time for you to hear from one of your colleagues. So I think I'll ask Elisa Chatterjee if you could hit *6 and mute yourself. If you're ready, welcome from the great state of Oregon. And maybe this would be a good opportunity if you're ready to share about the processes that you've used in Oregon that have brought you to wherever you are. You can tell us where you're at in the process and what you've done to bring the state to that point.
Sure, yeah. My name is Elisa Chatterjee, and I am the legislative coordinator for the Early Learning Division in Oregon, and I led the strategic planning development process of our Early Learning Council, and we developed Raise Up Oregon, which is a 5-year strategic plan for the full early learning system. And I'll kind of walk you guys through what we did. So one of the first elements or concepts we kind of dealt with that Jim really outlined as well is we tried to think of the early learning system beyond the early care and education sector. And so what we did is we brought together agency partners from human services, education, health, including public health, behavioral health. We brought together housing and community support. And we all worked together with the Early Learning Division and the Early Learning Council to kind of think about how all of our agencies collectively need to be working together to better serve children and families. The council has 3 goals for their early learning system. It's that children arrive ready to succeed in kindergarten. They are raised in stable and attached families, and that the system is coordinated, aligned, and family-centered. And so those are sort of the overarching goals that we used as sort of the framework for this process. So the council had identified that their current strategic plan was really very focused on the ECE sector and largely accomplished. It was very task-oriented. And so we set out to do a year-long strategic planning process that was really focused on the full system. We did some initial sort of community engagement through our early learning hubs. We have 16 regional early learning hubs throughout the state to kind of get a sense of what communities are experiencing. And from that, that's how we brought housing to the table. Housing has not traditionally been on the Early Learning Council or in these conversations. That was sort of the first shift we made. From there, we spent 5 months doing stakeholder engagement. So the council would hold about 5-hour meetings once a month to hear from parents, providers, researchers, advocates, and agency staff sort of within each sector to hear about what communities are experiencing, what research sort of has told us so far, what best practice is, what barriers are communities experiencing to be able to sort of better support children and families. And we took all of that information and we also fed that back again through the early learning hubs. So we spoke with all 16 hubs and their governance boards. Those governance boards are comprised of cross-sector partners sort of at the local level, so local Department of Human Services staff, local private sector partners, nonprofits, local public health offices, superintendents. Those are all sort of the members that comprise those governance boards to sort of see throughout this process if what we were hearing was reflective of what they're hearing in their own communities, recognizing that, you know, like all states, every community is different. And we also utilized some support from Head Start and the Hub to do some parent and family engagement sessions. So we had a couple of sessions with Head Start parents and sessions with parents that the Early Learning Hubs convened. We were also able to use information we collected a year prior in our infant childhood needs assessment through the 0 to 3 program that had really kind of highlighted the lack of access to infant care in particular. And so we took all this information together and worked with the Early Learning Council and agency directors to come up with a strategic plan that maps to those 3 system goals I mentioned earlier. And so we broke it down structurally Within each system goal, we had then identified objectives, and within each objective, there were multiple strategies. And then under each of those strategies, we had bullets that started to get a little bit more in the weeds on what implementation would actually look like, what are some of the steps that have to be made, not to the point of convene a work group, but to be able to kind of further define what the policy goal would be to get towards children ready for kindergarten, get towards a coordinated aligned family-centered early learning system. There's another piece I wanted to highlight. We're very lucky to have the support of the governor in Oregon. She really recognizes the importance of early childhood, and so she simultaneously convened a children's cabinet comprised of the same agency directors as well as some community partners, including legislators, as well as nonprofit and judges sitting at the table to really underscore the importance of agencies working together and underscore the importance of incorporating community voice throughout this process. And so we were able to have those frank conversations about the barriers that exist, about the policy choices some of our partners make with federal funds and the barriers that might be creating for families. And really try to put together an ambitious plan that is hopefully achievable in the next 5 years, but that we recognize if we can accomplish this work in the next 5 years, ideally the lay of the land for children and families would look very different and be much more supportive and focused on children and families. And we've really been working with our agency partners to kind of underscore that common thread that early childhood kind of poses. As we think about transitions, between preschool and K-12, as we think about ensuring that parents have access to the mental health supports they need, ensuring they have access to housing assistance and stable and affordable housing, making sure that they're not food insecure, and sort of all of these pieces that are so, are so important to ensuring that children are set up for success. And so this plan really is nuanced, and what we were also able to do is look at, we asked all of our agency partners to look through sort of drafts of this plan and identify any areas that are captured in existing strategic plans. So, for instance, Department of Human Services noted where there's alignment with their self-sufficiency action plan and their child welfare action plan. Department of Education noted where there's alignment with their strategic plan. So in our plan, you'll actually see the agency icons next to the strategies that the agency said they're already working on or plan to work on in the next 5 years. As we move towards implementation, we've just entered a phase of asking all of our agency partners to indicate what additional strategies they want to prioritize, or that they see themselves playing either a convener or sort of co-lead role in. And then we're working with agency staff to kind of hold agencies accountable and make sure we're aligned, as other groups might be convened, make sure that work isn't lost and it stays aligned with the plan. And then we're just now in the process of working with our early learning hubs, local public health offices, and coordinated care organizations in the health system to start identifying their roles in implementing this plan so that we can start to get that community ownership as well. So it's a lot, and I'll pause if there's any questions.
Thank you so much. It looks like some folks are maybe typing some things in the chat box.
Yeah, I guess gosh, I had myself on mute here. I was talking away. I was trying to make sure I was quiet. So it's amazing amount of collaboration, Alicia, that you've been able to assemble within the state. And I guess I first have a question around, did that, I guess, the attitude of collaboration, what was it in place before this B-5 funding came out, or is this something that you facilitated and nurtured, and maybe could you share a few hints about how that collaborative relationship has happened?
Yeah. So this was in place before the B-5 funding came out. I think a big driver was the governor's children's cabinet. She really impressed upon agency directors that they needed to be full and willing participants in this process. I think the other piece is we've had some agencies more than others just really, really believe in this work. And so they just prioritize these meetings. They prioritize this time. And I think that was underscored by the governor, but just having that inherent belief that this work is important and that they felt like they needed to have a seat at this table to do the work well, and they could see the return on investment for themselves. That I think was the other piece. I would say for us, our biggest collaborators in this process have been health and housing. So they really just because their agency directors really see the alignment and the opportunity, they've really prioritized this work. With K-12 and with human services, I think we've had a little bit more, we've had to work a little bit harder to get on the same page and work through, a little bit of, turf concerns. And I think that's where the governor's children's cabinet kind of could help us with some additional leverage, because she could kind of say, you have to do this and you have to come to the table. And throughout the process, they've become more understanding about the opportunities. And as we've actually gotten, additional funding through the legislature, and the legislature is talking a lot more about early learning, they're seeing why they should be a part of the conversation and the advantages to being a part of the conversation early on.
Wow, that's amazing, and I think it does reflect. This seems to be also applicable to a variety of settings in both corporate and in education, where leadership plays such a critical role in being able to nurture and to support these types of activities. You're very fortunate to have a governor who feels so comfortable in voicing this. One of the questions, Alyssa, that we got, this is from Heather. She's wondering if the state agencies self-identify where their work aligned or where they were working on areas within their strategic plan. So did this come about naturally, or was this a facilitated process on your part?
Yeah, so this was a facilitated process. We had sort of 3 opportunities total where we've done this. The first one was as we were developing the plan, we sort of gave a draft of what had been developed so far to our agency directors. And our council chair and our early learning system director sat down with each agency director to kind of walk through the strategies that we thought they would probably be interested in to see if that was accurate. And they gave us a lot of feedback and nuance. They gave us some feedback on, wordsmithing and what's a more accurate representation of the work that's going on or needs to happen. So that was the first round. The second round is, as we were almost finished, we have an annual council retreat. That's a 2-day retreat, and we spent a day and a half just doing strategic plan development before moving into council business. And one of the activities we did was a DOT activity, and we broke everybody up into 3 groups by system goal. And it was cross-sector groups of agency staff and council members who sort of took a first whack at placing dots or half dots within each strategy about where they think each agency would have a role. And then that led to some really great dialogue. If the health agency director wasn't in a group and the group had some health dots, he'd give feedback and we kind of discuss. We also surfaced that everybody kind of approached the activity differently, so coming up with a common understanding about what these roles mean. The last phase has been, as we're looking at implementation, we took all that feedback from the retreat and turned that back around to say, do we accurately capture, your thoughts and feedback with this final plan? And so they indicated where they thought they should have a larger role, no role at all, whether it should maybe be a more of a participatory but not lead role, and also indicated what their priorities would be for the next 12 to 18 months based on work that's already underway or that they've been charged with doing by the legislature that aligns with the strategic plan.
Well, that's amazing. And also, I mean, it's tough to say as someone who's done a lot of, many of these strategic planning and dot processes, I like to call them, to actually see it, come into fruition and an action plan is just, enlightening and heartening, truly, because, so many times those dots get stuck on a piece of poster paper, and then they wind up in somebody's shelf somewhere. So this is great. I like to tell you how fortunate you are, and just a reflection too that California, at least it seems, has supportive leadership and governor, as you all do. So the West Coast, I have to say, is stepping up there in moving the process along. Rachel, we have another question before I let you go, if you don't mind. Rachel.
Yeah.
From Nevada says, how many coordinators in their full-time positions went into managing and making this happen? Were those positions already in place, or were they created for this?
Yeah. So I was sort of the main staff that took lead on developing this, and I was the council administrator at the time, and my role kind of shifted midway, and so we sort of just modified what my work was. But we did work with the Build Institute, and we had a consultant to really help us. We had one consultant who really helped us focus on the facilitation for each of the in-person council meetings, those 5-hour meetings, and we had another consultant that really helped us with the writing, the formatting. Build was able to bring to the table a graphic designer as well to help us with formatting what the final document looks like, helping us find the right images, working with us on the design of an executive summary. And so we developed the content. Again, I was the lead, but I worked with our director and our policy team. So there were 2 other staff who really were the lead in writing this with me. And then the consultant helped to kind of package that together. So it was an intensive team effort for about 8 months. And after that sort of ended, I've moved more into that implementation phase of things. We've still been receiving some support from Build to help us generate sort of a slide deck that could be used by a variety of partners to help talk about this work, as well as help us kind of finesse what implementation looks like at the agency level. So we'll have our first agency implementation meeting on July 8th to kind of kick off and help everybody understand what their role will be moving this work forward.
Excellent. Thanks so much. I'm going to put you on the spot one more, and I promise, and I'll go back to the rest of my slides. So Maggie is asking, first of all, she says, thanks for sharing. The question is, it sounds like much of your work was in process. I'm making a reflection. So relative to her question is, sort of, did you do another needs assessment? Are you planning another needs assessment? Have you updated? How do you know that this plan that you put into place, which has been in process, continues? Here's a good, sort of an add-on. How do you know that it continues to meet the current needs as you shifting population?
Yeah, no, we are planning on doing another needs assessment. It's great because this really aligns with some legislation that recently passed in our legislature that charges us to do community plans and community needs assessments for both our infant toddler pilot called Baby Promise, as well as a preschool expansion bill that was passed and some additional funding we received from the legislature. So our sort of approach with the full strategic plan is that it is flexible and dynamic. We are building in sort of an annual review each year. Our plan right now is, there won't really be alterations to the physical document probably for the first 2 years while we work on the needs assessment and work on collecting that information, reflecting back, get our committees up and running, and get implementation work down the road. But our plan is every few years to revise this plan. I will say, too, our hope was that we built a plan that was specific enough to give direction, but broad enough that it could that it could capture other ideas. And so I think one of the things we're going to look at as the needs assessment rolls out is there work that maybe wasn't articulated exactly the way that communities are asking for it, but can be captured in existing strategies or objectives that are already in the plan.
Thank you. That's great. I really appreciate you sharing the information that you did. Everybody, sort of put her on the spot. So thanks so much. Thank you very much for sharing. You have a wonderful process in place in Oregon, and we all will look forward to seeing your plan. And I bet you many people will be taking a look at that once it gets posted.
Thank you. Yeah, happy to share.
Okay. I'm going to move on to some slides. I see another questions come in, but we'll wait on that one for a little bit if you all don't mind. So I wanted to get to a few slides to talk about further to get into the guidance document because I did make a commitment to do that. And then next we'll also have an opportunity to hear from Laura in Virginia and get back to the chat box and questions. So let's first, or next, talk about managing the scope of your plan. For those who are new to the process, or if you're doing some revision or plowing through the process itself, the first part will be, of course, to identify the individuals and representative organizations and agencies. Doing a collaborative process does require an ask. I have to say, of the organizations you want to be a participant, and not only they ask, but that they identify an individual to be a participant, and that agency agrees to some release time for that person to be a part of the process. I often say that collaboration tends not to be a natural act. It happens well when you get people engaged and they feel a sense of trust and security in the process. But it's something that needs to truly, I've said this word a couple times, to be nurtured and facilitated by whoever is designated to be responsible for doing that in your state. And the person that's designated to be responsible to do that has to understand that that is their role, is to nurture and bring these individuals into a place where they feel comfortable in sharing and as well as taking on responsibility. You all had to create a vision and mission as a part of your application. I would say another important part in the strategic planning process is to make sure that all of your stakeholders and partners have bought into and agreed to the vision and mission that has been set. Hopefully that vision and mission was developed as a part of a consensus building process when you put your application together. But some of the new players that may be around the table as a part of your stakeholder and partnership process in building the strategic plan may not have been a part of that vision and mission building consensus process. And it's important to go back and periodically revisit that to make sure that every time new players become a part of the conversation, that they too agree to the vision and mission that has been identified. Some of the next steps around the plan would be identifying goals that address each domain. Remember, I mentioned that earlier. It's going to be important for you to make sure that your plan addresses the essential domains that were a part of the needs assessment process, as well as, we recognize in conversation with many states that there are value-added strategic components that states are adding above and beyond the critical domains that were mentioned and identified in needs assessment. And one easily identifiable component in many states has been the workforce. That was not specifically a domain that was requested that states explore, but I do know that many states have added workforce as an integral part of their both needs assessment and strategic planning process. your plan needs to identify measurable progress indicators and objectives. It's important for each state to identify how they plan to monitor the ongoing implementation of the plan that they propose to put in place. I tried to give the equivalent to, while some people cringe, that this is sort of like a weight loss or a weight gain process, depending on wherever you are on the scale. Chuckle, chuckle. But if you're monitoring your weight up or down, you likely step on the scale daily or weekly or monthly to make sure that the action steps you're taking around your weight up or down is having an impact and is successful. And the same needs to be true to your strategic plan. You need to think of it as an accountability management process, and your identification of your progress indicators. What measures are you going to look at every 3 months, every 6 months, on a quarterly basis, on an annual basis, to check in to make sure that the processes that you set into place are helping your state accomplish what it is that you set out to accomplish. You can't wait for 12 months to make a determination that what you've attempted to put into place has not had an effect. Because when you're thinking of a 1-year, 3-year, or 5-year plan, waiting 12 months is too long. So when they're asking you to look at your your measurement indicators, they want you to plan something much more. Think of like an IEP, an individual education plan, where you're looking at the success or lack of success of the action steps that you've identified, and are you meeting your goals and objectives in an appropriate trajectory that you set. And if you're not, fine. I mean, there's nothing wrong with that. In a good management and leadership model, then you're taking the action steps to recognize that you've not made the progress that you have to do, and where you need to make adjustments and modifications. That's the critical factor as the next step in the process. Is there a good sequence of strategies and action steps in your plan? Have you identified the persons responsible? It is critical that if you set goals and objectives and action plans, does the person who's responsible for that know that they have that responsibility and that they have a reporting responsibility to whoever is managing the overall scope of the project? Have you identified your collaborators, and do they know that they're collaborators as a part of the process? And what contributions is the collaborating partner expected to make? Have you determined the resources that you need to accomplish the task? And have you identified the completion date and established an ongoing monitoring checkpoint? So that last bullet reflects back up to the identifying measurable progress indicators as a direct link. I know this is hard to see on this particular slide, but in the strategic planning document, we gave you a sample outline. It's very important for you to know that this is just a representative sample or example. Plans do not need to look like this, but they should incorporate to some extent the critical categories that you see listed under a description of your process, your vision and mission, your stakeholder members, the goals, objectives, action steps, and progress indicators. Again, this was meant to be just a guide or an example. It could be vertical, it could be horizontal, it could be in a narrative format. Whatever works best for the audience that you're creating the strategic plan for will be the model and framework and format that works best for you and your state. It's important to that you consider the plan alignment with your plan components. How does the strategic plan reflect these alignment elements? Again, so these are the critical components that I've addressed that need to be a part of the plan. So this is sort of a checkpoint. As you go through your plan, are these critical plan components reflective in a document that you intend to submit to ACF for review? There's an alignment table in your strategic plan document and the guidance document that you received on pages 5 and 6, which lists for you the strategic plan components on the left-hand side, and then a set of key considerations for you to consider relative to each component. The suggestion is to go through that alignment table and ask the questions of yourself, of your group, of the plan, and does your plan reflect the considerations and the components that are listed in a guidance document? Again, this is guidance. It's not mandatory. There's no regulatory process in here. This is the plan, I'll say again, that you've created for your state, for your stakeholders, for your parents, for agencies that are participating as a part of the mixed delivery process. Does this plan work for them and for you? And is it? I wanted to key into a comment that Alyssa made before, that your plan is not a static document, that your plan reflects a dynamic perspective on the services that you hope to provide and you expect to provide for children and families. And is it written in a way that it can be modified and adjusted as your population shifts, change in state? I'm going to pause there for a second, catch my breath, and now I think it would be a good time, hopefully, that Laura Kastner from Virginia, who's been patiently waiting, thanks, Laura, if you want to *6 on your phone to unmute yourself, and Laura, if you, thanks again for being a part of the discussion today, and can share some of the process that you all have done in your state to bring you to the point that you're at in your strategic plan.
Sure. Thanks, Jim and Sammy, for the invitation. Can you all hear me?
Can.
Okay, wonderful. That *6 is reliable this time. I'm glad for it. Thanks so much for the invitation. I'm representing Team Virginia in this PDG adventure, and wanted to give you a little bit of insight into the journey we've been on the last 6 months, but certainly some of this work predates that time frame. So we wanted to, of course, work on developing the needs assessment and the strategic plan in tandem, given the tight timeline and the fact that they very much align with each other, as Jim's last point just alluded to. Depending on the outcomes of the needs assessment, that would, of course, inform the goals that we decided to focus on in our strategic plan. So as we think about strategic planning processes, typically 6 months is a pretty fast time horizon, as I'm sure some of you are feeling in your states. But we decided to capitalize on the work that's been done, extensive work that's been done in the early childhood space in Virginia over the course of the last few years. In fact, we found there were 14 reports that were conducted over the last 5 years cross-agency, including evaluation of our first PDG effort, known as VPI Plus, so our preschool development grant aimed at increasing access and quality in the preschool year. We also had a report from our JLARC, which is the Joint Legislative Audit and Review Commission of all early childhood services. So we really felt like we had a lot to work on and build from, as opposed to starting from scratch, which made this 6 month timeline a bit more realistic. So we secured the help of a consultant. Communitas Consulting is the company that we partnered with. They're based out of Charlottesville, Virginia, and Sapphira Baker, the principal, I believe, is on the line listening in, and hopefully will fill in any gaps that I missed. But Sapphira and her team have been wonderful at both doing all the facilitation work around the development and the sharing of this needs assessment and strategic plan, but also leading the research. And that consisted of the primary research, which took the form of interviews and focus groups with key stakeholders across the state, but also, as I said, that foundational work of going through secondary sources that had already been established over the course of the last 5 years. So their interviews and focus groups took the form of, were all over the Commonwealth in a very geographic representative area, and they also included approximately 100 voices, everyone from providers and daycare directors, child care directors, to families, to teachers, and also any experts and stakeholders that were occupying critical roles in the Virginia space and in our context. So we feel very confident that we got a very thorough snapshot both of the primary data and the secondary data. So in terms of our strategic plan, the overarching questions that we tackled, that Communitas helped us to tackle, the first one was, what actions would enable Virginia's publicly funded ECCE programs to better prepare all of Virginia's children, especially those from under-resourced communities, for kindergarten? What changes to the ECCE infrastructure would it better enable all of the children ages birth to 5, especially those from under-resourced communities, to access these programs? And what measures should be used to demonstrate progress and foster accountability for the above actions and changes? Lastly, we also wanted to leverage lessons learned from our mixed delivery pilots, which have been in process for a number of years. We've had 3 rounds of mixed delivery grants funded by our General Assembly, and we wanted to make sure that we were learning from the people leading the way, which are the localities with boots on the ground. So we wanted to know what we're on, where they're barriers. So that's essentially our scope, the overarching questions, how we approached it from both primary and secondary data sources. And in terms of who were the key players in this beyond the consultants, we certainly had all the staff from the PDG team at the Department of Education in Virginia, which is a lead agency. We also are in partnership with the Virginia Early Childhood Foundation and the University of Virginia. And we also wanted to leverage a pre-existing standing committee that was created by the General Assembly in 2016, known as the School Readiness Committee. And so since that body already existed and served as our statewide, we had that serve as our statewide advisory committee. It consists of legislators on both sides of the aisle, senators and delegates in our state house, the leadership of Department of Social Services and DOE, the commissioner, the superintendent. We have representatives from the State Board of Education, private providers, Part C coordinators, school superintendents, researchers, and even leaders in the philanthropy space in early childhood. So it's a very representative and diverse group. And so the School Readiness Committee ultimately is the one that we felt like would help to give the green light on this process, but engaging a large group of 30-plus people in really meaningful strategic planning work can be a challenge. So we chose to name the group that would be actively working in this space with our consultant and with staff, our Impact Work Group. And so essentially we chose a subset of that committee as well as other invited stakeholders to guide these conversations and to report back to the School Readiness Committee. So this Impact Work Group met 3 times. We met in March, April, and May, so once a month. And Communitas diligently brought findings from their research at each interval. So at the first month, we really focused on reviewing pre-existing data sources and what lessons and findings were presented in those reports. The second one was more of refining ideas of some actionable places where we could make changes in Virginia that was developed in that first meeting, and also bringing the voices from community levels, from the primary data sources to the group to see if there was alignment there and to see if there were any gaps. We also worked with that group to create the definitions that were laid out in the FOA that were required as part of this process. And we worked each time, each month was a matter of iterating on refining the goals and making sure that we were focusing on vulnerable families, and then developing strategies and a draft of guiding principles that we would bring to the School Readiness Committee. So I'll tip my hat a little bit and just give you the 5 goal areas that we landed on as a Commonwealth. as our draft strategic plan. Certainly this is operationalized in objectives and strategies beneath it, but just to give you an idea of what we decided to include in our scope. Access and affordability is the first. The second is family engagement and support. The third, quality and ECCE workforce, which, as Jim mentioned, was not a required piece, but we felt was very critical to addressing these questions. 4, state accountability and governance. And 5, local capacity and innovation. Again, tipping our hat to the fact that, not all answers can be solved or all problems can be solved from either DC or Richmond, Virginia. That local flavor was very important. So we brought these draft goals along with their component pieces to the School Readiness Committee on June the 7th. So this just took place. And we are, again, Communitas has been a wonderful partner at creating very engaging formats for us to share with this very influential group, to share our process, to review the draft 5 goals, to have them very literally interacting with the wording on posters, underlining the words they wanted emphasized, any question marks where they didn't understand. And based on the feedback and activities over that 5-hour day, Communitas is currently engaging and refining even further and getting feedback basically to know if the strategies that we laid out in the draft are on target or need adjustment from the perspective of the School Readiness Committee. So that is where we are right now as Communitas is revising. And as far as next steps for us, we have summer listening sessions planned around the Commonwealth. In fact, that's my next task, is to coordinate with the Commissioner of the Department of Social Services and the Superintendent of Schools of Public Instruction at DOE. These 2 gentlemen will be visiting 4 or 5 different meetings around the Commonwealth across the geography to share what we've discovered through the course of our needs assessment and lay out our draft plan, and essentially listen to key stakeholders on the ground by partnering with some local providers. And so we're very excited about that, hopefully as part of socializing this process, finding any pain points or trouble spots and making sure that we're responsive to those. So that is it on process. In terms of lessons learned, we've been really overwhelmed in a positive way about the level of engagement that we've had cross agency and within the impact work group, as well as in School Readiness Committee. Very enthusiastic and engaging participants, as opposed to, reluctance or just listening from a distance. We've been very encouraged by that. And as far as a challenge that we've identified, but again, we've hopefully found a way to ameliorate that challenge, is making sure that we have ample representation of Spanish-speaking populations in our primary data collection. Despite best efforts at recruitment initially, we came a bit short of where we would want to be in terms of making sure we had adequate representation of that population. Again, a lot of that bigger than us, with some national pressures and perhaps some worries about engaging with government officials. But we're working with trusted partners, again, that we've connected with through the Impact Work Group and the School Readiness Committee, to double back and make sure that we are indeed capturing adequately what the population needs. So that's where we are. There's challenges and engagements because there's lots of voices, but there's also great opportunity there. And so we're excited to see where the next chapter takes us as we continue to refine and socialize this. I'm going to pause real quick, and Sapphira, if you are on and have anything you want to add, either that or chat in the chat box that we're good, wanted to make sure I gave you that opportunity since you've been living in this for quite a while. She's typing. We're really good. Yes, we are. She's really good. Jim, I'll turn it to you in case there's any thoughts or questions.
I guess nothing yet specific to your discussion. We do have a greater question, which I'll get to in a moment. But I do have a question around relative to this unique population that you're trying to get at. For instance, those that are non-English speaking. Can you talk to, for a minute, of the strategies that you employ to try and reach out to some of those specific reluctant groups or harder to reach groups, and how you have brought, even the ones that you've been successful with, how you brought them in and, as part of the engagement process.
Sure. And again, perhaps Sapphira has more insight on this, but we worked collaboratively with pre-existing networks across different communities in Virginia, known as the Smart Beginnings Network. These are trusted partners on the ground who help facilitate our Virginia Quality, the QRIS system, and also work providing TA to local ECCE providers. And so they're a very trusted network in this space. And so we made sure we leveraged those folks to try to reach out and identify the right folks for focus groups as well as interviews. There were some bilingual materials that were developed and sent out. But again, it was we very much, given the short time frame, we relied on networks and systems on the ground that were pre-existing, but just helped to try to remove barriers in terms of language for their outreach. So I'll defer to Sapphira if there's any more to add there. But we did our best. But again, given that from Richmond we couldn't necessarily identify the right partners and parents and families in those communities, we relied on pre-existing networks.
Sure. Well, that's a great response. Thank you for sharing that. I think that makes a tremendous amount of sense in many situations. If you're sitting in a capital city somewhere and your engaging audience that you're trying to connect with is 500 or 600 miles away, you do have to rely on those existing networks and your local community groups, I think, to make those connections. So that was right on target, and I think that was a helpful bit of advice to share with your colleagues. Thank you for doing that. And while you're on, you may or may not be able to answer this, so I'm going to pose this both to yourself and Alyssa. So Jennifer sent in this question. She said, given the degree of agency coordination that you both have had, the data system coordination required to track progress seems immense. Where are you, or where does your state see itself in progressing not only on unduplicated counts, but also just in accessing sound data sharing agreements, to help you all do some data-driven decision-making? Have you made any progress there? Have you thought about it? What sort of actions have you tried to take around that?
Sure. I'd be happy to take first crack at it, Jennifer. This is actually a component of Virginia's PDG B-5 efforts that we're very excited about. We're partnering with the University of Virginia that has developed in the past a PALS assessment and systems. If you guys are aware, probably using, numerous states do. Virginia does very widely the phonological awareness literacy screening. So practitioners in the field, certainly in the pre-K space, have had lots of years of experience entering data into this PALS interface to collect data at the student level across communities that's then aggregated up to the state level. And so we thought they would be the best partners to help us build a parallel data system for capturing both elements of access and quality in the birth to 5 space across our pilot communities. So we're working with 11 pilots in this first year and incentivizing them to conduct a count at a given point in time that we will say, as of this date, we want you to give us a good census of the number of kids that are in your building, the number of slots, the number of, based on age, the number of students with special needs that you're serving. So both access measures as well as quality measures. We're, again, providing incentives for them to engage in class ratings of the interactions between teacher and student to student to try to get a feel for the baseline of quality across these early childhood programs that not only will give us a good idea of where we are as a Commonwealth, but also will give us actionable data points that, in theory, we can harness later towards tracking and seeing improvement. So you're right, there's a lot of, it's very cumbersome to think about data sharing agreements, and so at this point we're just building a proof of concept in partnership with UVA through the PDG efforts but we're hoping to learn from the experience of these 11 communities, good and bad, right? So we anticipate our preschool teachers housed in schools and Head Start will have minimal trouble with this. We expect some sections of Southwest Virginia and the mountains may have internet connectivity issues. We anticipate some family day home providers to have, limited experience with computers. And so across this diversity of settings, this is certainly not only a place for us to get the data, but also a test bed for potential problems and how we might address those in the future as we move to scale.
Thank you so much for sharing that. Alyssa, do you have any thoughts relative to this question? Sorry to put you both on the spot for this, but your colleagues posted.
Yeah, yeah. No, this is a huge one, and we have pretty much all of a good portion of our system goal 3 is really focused on data sharing. One thing that we're kind of doing in the interim, a parallel process to the development of the strategic plan, is we've had a committee convened that's comprised of agency staff, early learning hub representation for sort of that community lens, and early learning council members. And we've been working on creating an early learning dashboard, and it's sort of an interim step as our state continues to develop and expand its statewide longitudinal data system, which right now is primarily focused on K-12, and its next phase will be focused on higher ed. So we're in the queue, but we're down a ways. And so what this dashboard does is it's been a lengthy process, but basically we've taken all the measures that our agency partners collect through surveys, through Medicaid billing, things like that, and mapped it to the strategic plan to see which data points may be indicators of whether we're reaching that objective and working towards that system goal. It's not intended to be used as an evaluator of how well the strategic plan is working, but rather just to give us that sort of progress update. And so we're hoping to have that finalized in the fall as sort of an interim way to build off of the data we currently have. And the agency that collects the data would still own the data. It would just all be displayed in a way that we could all easily see and access it alongside the plan. And then there's been some other movement again with some bills that are poised to pass through the legislature by the end of the month that would kind of give us some additional funding to start looking at some of that unduplicated data, working with our partners at Oregon State University. But it's a huge list, and so this dashboard is sort of our first pass at being able to kind of openly share the data that's at least related to the strategic plan. And I'll say our agency partners, this process has, I think, been really illuminating for everybody. When you see all of our data, even just the indicators, the measures themselves, and not the data points, see them listed out side by side and alongside the strategic plan, it just really has sort of emphasized the cross-sector collaboration and all the ways that our agencies are touching children and families.
Excellent. Thanks so much. Thank you both for sharing that. I know that the more comprehensive data process is big. It does require a lot of attention on behalf of states. You all have made some good progress along there. Just a little plug, we will be sponsoring Atlas, the TA, MITRE Atlas TA will be sponsoring a series of webinars during the month of July going into early August. We'll do a weekly conversation around data. We'll be looking at data governance. We'll be looking at data integration. We'll be looking at data privacy. We'll be looking at sharing of data between Part C and IDEA 619. So stay tuned. An announcement will come out about that because we know that this is a topic of conversation and interest to many states. So, and thank you both so much for being willing to put yourselves out there and sharing the experience. I know your colleagues are very appreciative of your willingness to step up to the plate. So I see we have nearing the end of our time. I do want to get to a few things folks, please do not hesitate if you do have some more questions. If we don't get to them today, we will be collecting those questions and then posting documents both from the needs assessment call as well as today with those questions and answers to those questions so that you have them for your reference. Relative to the submission plan for the strategic plans, when you're ready to send something forward, there is a cover page and an executive summary is being requested from states. Identify for the reviewer where they will be able to look at how you've addressed each of the domains that I've talked about in the presentation today, and where they can link to those domains in your strategic plan. If you've made recommendations in your needs assessment, please make sure that those particular recommendations are addressed in your strategic plan. If no immediate actions required for any of the domains, those essential domains that came from the needs assessment, identify how that item is already a part of your longer-term state plan. So if it's not something that came up as immediate, it certainly be something that's a part of your overall comprehensive approach, and your plan or your summary should address that particular issue. You do want to make sure that everybody knows that any of your respected TA specialists, Maria, Sue, Chris, Hesley, Sammy, Gory, myself, we are happy to look at a draft of your plan. If you want to have us review it, we'll be happy to give you some feedback. Totally understanding that our feedback, again, is not a sense of approval, but again, recommendations for what you might do to continue to enhance the wonderful work that you've put together. And when you're ready to submit your final submission plan, your strategic plan, you should send it to the following 4 people. 1 to Richard Gonzalez at ACF, to your federal project officer, to your TA specialist, and to your regional Office of Child Care office specialist. And if you don't know who that is, check with your TA specialist or your federal project officer, and we're happy to get you their name and email address, though we hope you're intimately involved with that person too. I see we have about 8 minutes left in our conversation today. One of the questions that somebody asked, I noticed, the original question was, would Virginia or Oregon provide a link to their needs assessment, and no one yet, to my knowledge, has posted their needs assessment on any of their respective websites. To date, we are aware of 2 states having submitted their needs assessments for review, but no one has posted yet their needs assessment. We will soon be creating a community for our PDG colleagues, and it will be an opportunity to have a more confidential discussion amongst each of you, and that may be an opportunity for some of you to share some of the written documents that you could share amongst each other, or you could also certainly reach out to each other. We do encourage states to be able to do that. You're also welcome to, and of course encouraged to have continuing conversations with your federal project officer, as well as your TA specialist. We are in the process of setting up several peer-to-peer conversations, so linking one state to another state that have indicated to us, a specific ask and request. Today, in the last slide, as well as in the follow-up email communication that you'll get from us, we are very interested in knowing, are these communities of conversation meeting your needs? Are they helpful to you? Is there some additional feedback you'd like to provide to us around these conversations? Because we do want to be as helpful to each of you as possible. Here is the survey link to this conversation today. And do we have any other questions? I don't see any others necessarily in the box, but I think we might have time to address one or two questions. I think I know we had a couple come online previously. Sammy, do you want to share some of those, or?
Yep, sure, I'm happy to. So the element in the strategic plan guidance around assessing the current federal, state, and local statutory requirements, one state had asked, how can they make it clear in their plan that they're addressing this element?
Sure, great question, and it's something actually that Richard and I have had a conversation about. You know, I think what's important in the strategic plan is, first of all, I'll say it again, that the plan is a document that's intended for your stakeholder and partner audience. So I think it's first would be a recognition by the state that they're aware of some of the either federal, state, or local statutory requirements that impact the goals, objectives, action strategies, and outcomes that you hope to meet as a part of your plan process. So are there particular statutory or regulatory or policy-related statements, expectations that facilitate the process and that you anticipate utilizing to further the work in your state, or are there some particular barriers that you know are currently hindrances of this process, and that at least you may not necessarily be able to immediately rectify those barriers, but you're cognizant of them. And that you know, part of your state plan is to do some strategizing and to make some linkages and have conversations to see if there are any ways to work around or through or change some of those policies or regulatory requirements to better strengthen your system. You know, there is an expectation that you'll solve them all, and certainly not solve them within a year. You know, oftentimes regulatory expectations take, you know, multiple years to work through because it requires additional stakeholder and partnering to have those conversations, to make those changes. I think what's most important to reflect in your plan a recognition of what those regulations and expectations are and how they impact the ultimate success. And if they are hindrances, what strategies at least you hope to take to engage your partners in that conversation to move the process along.
Thanks, Jim. Maybe we'll squeeze in one more. And this is kind of maybe for other folks on the chat to talk about as well. I know we talked about linking the needs assessment to the strategic plan, but one state asked if there's any best practices or things that folks are doing when it comes to that piece.
I know while we have a minute or two left, and hopefully some people may be able to put this into the chat, I do think that we are aware of several states that have created crosswalks. So as they complete their needs assessment process and have their critical components that came out as a part of their needs assessment linked with the essential domain, they've created a crosswalk and walked through their strategic plan to make sure that they have made those critical links. And I know that there's a couple states that have created those crosswalks. I guess we would encourage those states that have created those crosswalks, if you're open and willing to sharing those crosswalks with us in a way that we could then share them with your colleagues. We encourage you to do that because we would take them all and post them in a way that your other colleagues around the country could utilize as examples. And I think that that brings us to 4:30. You all, outstanding number of people, maintained interest and attention to this discussion today. Thank you again to Laura and Alyssa for being a part of the conversation. It was great, wonderful to be with you all. If you do have further questions, don't hesitate to contact your TA specialist or your federal project officer. Thank you all again. And thank you to Sammy and to Tanisha behind the scenes for helping keep this Adobe up and running, and support, and to the rest of my team to helping us with the chat. And have a great rest of the week, everyone.
Thanks, Jim. Thanks, everybody.
Thank you.